My name is Paradi Mirmirani. I'm a dermatologist practicing in Northern California, and I run the Hair Disorders Clinic. I'm here in New York City at the American Academy of Dermatology Innovation Academy, and I am presenting a talk on hair loss and menopause at one of our sessions here. And I'm really thrilled, first of all, that this topic is even being promoted and included in the session. For so long, there's been so little information, so little talk about hair loss and menopause in particular, and we've really had a knowledge gap in this area. And that's despite the fact that there are so many women out there who enter menopause every year. In the US, 1.3 million women enter menopause every year, and let me tell you, almost all of them have a concern about hair loss. I've coined the term midlife hair crisis for these patients, and they really enter this period in their lives, in this transition, with blinders on. And when they come to the office to ask us questions about hair loss and ask us their concerns, we don't have the information to provide them either. My approach to hair loss and menopause is three-pronged, and I call it the three pillars of hair treatment for patients. And in some ways it applies to many different types of hair loss. But the three pillars I look at is hair growth, inflammation, and then lifestyle. And in particular for menopause, this is an opportunity to discuss these areas of concern with them and to really intervene in a way that can be impactful. So we have very good treatments for hair loss, and I won't get into all the details, but we can offer, again, evidence-based treatment for hair regrowth. In addition to that, though, it's also important to address any inflammation. We know that microinflammation long-standing can lead to what we call inflammaging, and that's detrimental in many different ways. So all those small changes that we can make, how they treat their hair, how they wash their hair, can impact hair growth as well and create a healthier environment for hair growth. And then the third is, again, that lifestyle medicine, which is so important, making sure that patients have optimal metabolic function, that they're sleeping well, they're exercising, eating healthy. That's just as important as all the other things that we do for them. I'm really hoping to share with the audience, the attendees of this session, a little more information about hair loss and menopause, and share the information, the data, the evidence that we do have in this area. And also it's a call to action as well, to inform ourselves as physicians so that we have better knowledge when we treat our patients, be able to answer their questions, but also to encourage everybody to think about research that's needed, still needed, in this area.